If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
Well, they did it. They shut it down.
Yes. Unfortunately, they shut it down.
Yeah.
Our government is not open.
No. I thought they might, but, Schumer's waffling. We're going to talk about it more, but just to, it's the only thing to talk about, man. Schumer's waffling on this. I just thought he might continue to waffle and kind of hold the line on this is ultimately not in the best interest. But to me, this also symbolizes a shift of power in that party. I think they finally, and it's coinciding with, Mom Donnie's inevitable election now.
Yes.
So there's
going to be a populist movement on the Dem side.
Has to.
And Madami, I think, is the first one of several, probably.
Yes.
And that's going to cause more strife, more fighting between everyone before any resolution, which we're seeing beginning with the government shutdown.
Yeah. And the center can't hold anymore. Right.
Yeah, there's no power in the center.
Not until we cycle back to some understanding that without the center, there is no us,
Yes.
But at the moment, the center won't hold.
Yeah. That's right. And unfortunately, a lot of people are going to suffer in the government shutdown, in all these things. I mean, Schumer and Trump are both getting paid. And a bunch of government workers,
essential.
a bunch of government workers are not. And that's not right, but I don't know how to change it.
Yeah. All right. Nothing more to discuss. We have a lot of topics, so let's.
Well, I think we should note the first championship in the state of Tennessee.
All right. Thank you. I'm focused
can't
on.
Let that go without noting. So Nashville Soccer Club won a championship this week.
Yeah. I was there.
Yeah. And it was incredible. So tell me how it was. Like, how did it feel? Because you started the team, where you were involved in the beginning times of the team.
So, one thing I want to just say, there was a little bit of magic to the day, because, there's three guys in the ownership sort of group that I'm in. I'm one of the three. The other two are David Dill, CEO of LifePoint Health, and Chris Redditch, the co-founder at Provider Trust. Yeah. But there's a fourth one of us who is Chris Jones. Chris Jones is a guy who worked at Pinnacle, our bank. Yeah. And he's the founder of the club, man. Okay. This is the guy who sent out the tweet, who I wrote about in my book, who started Nashville Football Club, that when you go to games and at Geodis Park and you see the supporter section, that guy built that. Yeah. He built like one that at a culture. Time.
Yeah. Right.
He built that culture, the songs. I mean, even look, at the end of the day, it's like they changed the colors a little bit, but he picked the original colors, right? And so, we came on. I came on to support him. David and Chris came on to support me. John came on and got us to the top flight, right? Like that's if I'm keeping it simple, that's kind of what happened, right? And I don't mean to simplify it down to. What is that? 5 people. I don't mean to do that, but because there were so many other people all across the line. Lots of people
involved, but I'm just
those are the big inflection players. Point people in the story of the club. Those are the inflection point people. Right. Okay, and so
over 20 years, 15 years, long time.
No, 10 years.
10 years. Okay.
I mean, I got in
2015.
I got in 2014.
2014. Okay.
I got in 2014. It was still 4th Division Nashville Soccer Club. So there's a couple things that's special about it. Chris reached out that morning. Chris Redditch reached out that morning. Chris Jones is no longer at the club, and so Chris Redditch reached out to Chris Jones with me on text and was like, "Hey, Jones, you're coming to the match, and he happened to be off work, and so he literally could hop on a plane with us and go. So that was like first magic thing, and he and I flew up there together, and Jones and I flew up there together, and then we got to catch up, talk, and then we went to the section, and we were seated right in front of Redditch, in the supporters section. I think it was this amazing surprise for all the supporters who traveled, about 200, for all these supporters who traveled to see Jones there, right? Because it was a good omen. Let me just say that. It was a good omen that the founder of the club was there, okay? And man, these guys, you just could kind of feel like we were going to do it. You know, you could just kind of feel like we were going to do it. And it wasn't the prettiest game. It really wasn't. There were some incredible moments, but it wasn't the prettiest game. And it got a little, argy-bargy in there a little bit. We pulled it out in the end, and it was so incredible to be there with the supporters, seeing John and that incredible team that he and Mike Jacobs and BJ Callahan put together. And just what a season they've already had, coming off of the worst season in the club's history, regardless of MLS. I mean, like we were actually good in every division we were ever in. And that was last year was horrible. Okay. Yeah. We had to change out the coach, and this year has just been magical. And to put the first trophy in the cabinet. And then the last thing I want to say is, for people who don't know soccer, in soccer around the globe, you don't play in one competition. Every team plays in at least two competitions. It's like you play in multiple competitions, okay? And so this competition is the oldest multi-division competition in America. This is the OG.
I didn't realize that. So
this is the OG Soccer Cup, and it's really meaningful because we have played in it as we've been in all the different divisions.
As you've grown up.
Yes. Yeah. So we're not just some money team that came into Major League Soccer that had no legacy. We have a legacy in the third division. We have a legacy in the second division. We have a legacy in the fourth division. So yes, it was incredible to be there, to see it happen, to have the supporters both there, but also a great watch party happened here at Geodis Park, and there were so many incredible, important supporters who were there. And I just, I kind of have goosebumps just talking about it. So I wasn't going to talk about it. I wasn't even thinking about it.
But that's a much better way to start the show.
It was special. And then, as you said, it is the first championship. It's a true championship. There's no more games in the Open Cup. We are the Open Cup champions. Yeah. So we're like the national champions of soccer. And it's the first major championship win for a major league team in Tennessee history. Yeah. So that is hopefully the beginning of many across all the teams. We love the Titans. We love the Predators. But it's really special that a community built club made it from a tweet to the national championship in a little over 10 years, man. Yeah. A little over 10 years. So there you go.
Congratulations. A lot of work with you and everyone, all five of those guys, but hundreds of people. So it's a great win.
Look, thousands. I mean, it takes all this, all the season ticket holders, all it's at this point, the whole city's behind us, right? You know what I mean? And everyone has been so supportive and engaged, and all the people who fought for us to get the stadium set up at the fairgrounds. And, I could just go on and on about how many people in this city made that happen. I don't mean to distill it to a short group of people. Yeah. But for me, I got to stand next to the founder of the club when we won the first trophy. Yeah. And that is incredible. About as meaningful as it could be. So there we go.
Congratulations.
All right. Thanks, man. Let's now dig in. Now that you got me all teary-eyed and shit. Okay. The government shutdown begins as funding lapses. Yes, back to reality. Is there anything more to say about this? I mean, I don't have strong indications. There was a Truth Social post that I sent you. We didn't link it here. Yeah. But where President Trump was talking about a meeting he was going to have with Voight, the guy who is one of the architects of Project 2025, which is the thing that he throughout the campaign said he had nothing to do with and didn't know what it was. Yeah, now he's having a meeting with that guy, and that they were going to discuss which of the agencies now could just be totally shut down as part of the government shutdown, and like temporarily or permanently, wiped out, and talked about it being an incredible opportunity that the Democrats have provided him with. And so, it just seems to me like it was the last stand that Democrats had to prove that they had any spine. And so I understand them doing it. for their base, their whatever base is remaining, like to just show we will go down with this ship. And at the same time, it just seems like they are something like 3 to 10 steps behind this guy. Yeah. And I don't know what to, I don't know what to pull from it, right? Like, do I believe the Democrats have the staying power to keep this going for the long term? I don't think in a war of attrition they win.
No, I mean, both sides will take a lot of damage, but there's a lot more power on the executive branch than in the Senate. They just can't. They can't do that much. They can stop the government from being funded, but that's going to hurt a lot of Democratic bases. And so I don't know. I mean, I don't know where it ends, but it's not good today. And the longer it goes, the worse it is.
Remember when we used to talk about the writer strike in Hollywood against AI?
Yeah.
And of course, we're going to end the show talking about how well that worked out.
Yeah, right.
This kind of feels like that to me, right? It's like it's the best you know how to muster.
Yeah.
And so you're doing something and, like,
and they picked healthcare because that's the most common thing that they can pick that everyone kind of supports.
Sure.
But I don't know that that's going to work. I mean, I don't know.
It's not going to work well enough.
Not going to work well.
And also, like, they lost this last election so significantly. Right. And you have to sort of say that they lost it. Like, as much as the Republicans won it, they lost it. And it is their losses that led to H.R. 1.
Yes.
Right.
Yeah.
So now you're telling me as a party, you're just like an activist party. So you're not, we're not even in a 2-party.
No, they're just protesting
world right now. You're so minority that you are just an activist. And I'm thinking about, like, when we replay this show in 3 months, what will be the reality of it? And that will ultimately be the lesson we will have learned here.
Yeah, that's right. And I don't know. I'm ready for them to stop the shutdown now, but we'll see. Hopefully next week it'll be shut down. It will come back.
Yeah. Okay. These 6 charts explain why the government shut down.
Yeah.
From
The New York Times had 6 good charts. They're all healthcare charts.
Oh, okay.
Which is why I thought it was worthwhile to go through. But to your point, so these are all things coming out of H.R. 1. They are negative to healthcare. And so we should go through them. Maybe that's why that they shut down the government, but it's going to be hard to you're not going to get all this back.
No, you're definitely not going to get all this back. And look, here's the other thing, man. What makes me really long-term concerned about the Democrats, this is like my big long-term concern, right, is that they don't have any good answer for entitlements as a contributing factor to the growing deficit, right? That is a very worrisome hole in their positioning, generally speaking. The
Republicans don't have a good answer either.
The Republicans don't need a good answer, and they've proven that.
Okay.
They don't need a good answer. Their base doesn't require them to have a good answer.
Yeah, that's right.
Right. The Dems base is so eroded that if they're going to kind of grow it, one aspect of that has to be an acknowledgement of the bankrupting of the future of the country for the children who will inherit it.
Yeah.
And not just the boomers and the poor people of today.
Right.
Right. And so there's a lot of weaknesses they have, but to me, what I keep looking at is I'm like, there's nobody who
there's no plan around that.
There's no plan around that. There's no vision around that, And so, yes, I mean, look, I've poured through HR 1. We've done so many deep dives. We've seen so many.
None of this is new.
No, I don't even want to run through it. I think our audience understands HR 1. And we also know HR 1 is not going to be a deficit reducing plan. Like we know that too. So I'm not sitting here saying the Republicans somehow did it right. It's just they don't have to. They're winning.
Right.
The burden of proof is not on them. I'm sorry. They got all the control.
Yeah, and so that's the conundrum. I mean, the New York Times laid this out very well, and it's not new. Not new to healthcare people. It's not new to the general population, I don't think.
No.
And it's going to be a big fight to get some symbolic piece put back that's not going to really change the overall outlook.
Right.
That's the best case, I think, that they get some concession that they can point to and they open the government again.
Okay, so here's a question.
I mean, otherwise you just open the government with nothing.
Here's a question. What do you think, if you had to pick one thing, and I'll just throw two out there, work requirements or ACA subsidies, which of the two do you think is the one they really want? What's more politically valuable, work requirements or ACA subsidies?
What is more valuable, I think, is getting the work requirement removed, but I think the Republicans won't give that.
Well,
but that could be wrong.
Hold on. See, okay.
So on the Democratic side, I think
subsidies is more important.
Oh, really? Okay.
Yeah.
So that's what they should go with.
I think
that's
subsidies are more
easier to give.
Can I tell you my reason why? People on Medicaid are less likely to be influential in the body politic.
Yeah. Versus
the middle
Medicare,
class who is on the marketplace, who are in T-minus 30 days about to see what the rates are going to look like without subsidies and are going to freak out.
Yeah. That's more important.
That's more important. That's more important. That's more valuable.
Yeah. Well, that's what they should go with because that's what Republicans will more likely give too. I think.
We'll see.
We'll see.
We'll see. The credit market is humming, and that has Wall Street on edge. It's the Wall Street Journal.
After the great financial crisis, whenever that was, 2008, 2009, it's been very difficult for banks to loan to sub-perfect credit borrowers, which, has unintended consequences. The banks are safer, but now we have this big private credit market. And this week, I think it was might have happened on Friday, but it got reported this week. This company Tricolor, which is pretty large automotive, like buy here, pay here place in 3 or 4 states. They went out of business and went to Chapter 7, and there's nothing there. And what they were doing, it was securitizing the loans, right? So they take little pieces, and the way they used to slice it up, the first defaults go to the really risky classes, just like you did with subprime mortgages.
Yep.
They split it all up. And the senior credit that is supposed to be like AAA has so many, classes below it that the thought is that these things are not correlated together, and you're never going to get to where all these borrowers fail, except that it started happening. It started going up into the triple B, single A, and then it all cascaded down, and they went under. People are claiming maybe there's some fraud, but it's been I think a warning bell that the assumption that these debt holders are not correlated is not right.
Of course
it's
not.
Never right.
Of course not.
That's a thing that you say in finance class. We're making an assumption of a normal distribution with uncorrelated assets.
Okay.
Because you can't do the math otherwise. Not because anyone thinks it's true. And so Tricolor went under, and a lot of people are nervous because there's a lot of other private credit that is done in the same way.
Okay. All right. Something to keep an eye on. In a sea of tech talent, companies can't find the workers they want.
Yeah.
Wall Street Journal.
That's right. So the jobs that are open now, there are not qualified candidates for. And then there's lots of candidates that don't have the skills that the companies need. And so it's obviously a difficult
The future
situation.
is becoming much less evenly distributed.
Yes.
I feel like future readiness is now approaching the same kind of inequality as income. and the wealth gap. Like that K-shaped economy is also now starting to feel the same in terms of who actually understands what the hell is going on right now and who doesn't.
Yeah. That's right. It is not easy to be functional using AI in the workplace. It's not easy. You have to be using lots of different tools that don't work well to sift through them and learn. And that's a lot of people don't have time for that. And there's a lot of effort that needs to be put into it. And I don't think people have done it.
People are also worn down.
And they're worn down. Yeah.
This feels like my big point of acceptance recently is just, man, hadn't been a break since COVID.
Yeah.
You know what I mean?
That's right.
And whatever you think about it, the pace of change that Trump is bringing about is relentless. It's relentless. Mm-hmm. Whether you like it or not, the change itself, that volume of change is incredible. And the only people who I think are even reasonably tuned to it are either the people who architected it and wanted it, or the people who position themselves as part of the innovation economy.
Yeah.
Right.
Founders, entrepreneurs,
VCs,
technologists, VCs. Yeah. Right.
You know, right. And not all of them.
Yeah.
But like if you're in that world, you're kind of living the future all the time anyway.
Yeah. And you have information sources. You're used to change in a way that other people aren't used to it. So
yes.
Yeah.
Yes. The jobs report that wasn't leaves economists guessing. I'm laughing not at the headline, but if you were watching this, then you would see the what do you call it? Banner? Or what is that?
It's a 3-story banner of Trump's headshot saying "America Workers First."
Yeah,
on the front of the BLS,
draping the Bureau of Labor Statistics building.
Yeah. So today we were supposed to get the BLS labor report, and it did not come out. The ADP report that I don't think is very accurate came out this week, and it was not very good, but I don't think it's that accurate. So we don't have any visibility to what the labor market's doing.
So is now the point where we agree. I don't know that we should be reporting on the numbers. I mean, we can report on them, but like...
Well, there are no numbers.
No, but I mean, just... Vic, like...
It's bad. It's bad.
Like, there's no... The trust, right? The trust. I just don't... I'm an investor. I'm looking at these things to try to gauge the macro. I'm not interested in political gamesmanship.
Yeah.
Okay. And I don't know that the numbers that come out are going to be super helpful, you know, and I'm more inclined to simply say that let's track what we see coming out of the public markets. Like if they report job growth or job loss, I'm interested in that. But as a general rule, my view is we are going to compress labor with AI. And I've not seen anybody except for rose-colored glasses people say anything to the contrary. So that's what's going to happen.
That's why I think the Fed should have been cutting for a long time. I mean, we don't have AI is going to destroy jobs and cause deflation. And it might be in a long window of time or a short window of time, but in general, that's what it does. It's gonna make things less expensive and reduce the need for people. So the Fed, if they had that view, I think they would try to create jobs, create things to make it less bad. But we don't have any numbers coming out, and I think you're right that we have all learned that BLS is not very accurate. But I think they have been more accurate than ADP. And so, or maybe not. I don't know.
They haven't. They revised. No.
So maybe ADP. I should compare that. I don't know. I don't know. I can't tell.
I don't think either matters.
Yeah.
It's not clear to me that either matters.
Okay. Well.
I'm just telling you real time. I don't know that I care.
Yeah.
Anymore. HIT consultant. Folia Health secures $10.5 million Series A to scale patient-driven Real world evidence platform.
Yes.
So this is the first deal of the week that we are covering. The Series A round was led by S3 Ventures alongside Crosslink Capital and Create Health Ventures.
Yeah, so real world evidence is an attempt at doing clinical trials with patients that are actually getting treated for their condition right now. I hope it does well. It has a lot of promise. We haven't been able to see it get scale, get statistically relevant.
Correct. Yeah, this is one of those. It's coming big,
been coming
big
for a long
projected
time.
CAGRs and nothing that's actually materialized. So best of luck to them. Visana Health secures $24 million for Women's Health Clinic. This is a Series A round led by Nora Mosley. Participation from Cigna, Intermountain, Flair, First Cressy. That's a good group.
Yeah,
that's a really good group.
Spence, who led it, Spence McClellan from Nora Mosley, was in town this week. I met with him. He's super excited about it. It's they're delivering care in Minnesota. It's a clinic. So.
Not what I'm going to be investing in, but
right.
I mean, look, we don't have funds as big as them, right? So that's what we've kind of determined, right? Like we're focused on different stuff. Midi Health raises $50 million Series C for menopause care platform. Congrats to this team. They've just continued to. I have no idea how well it's actually performing, but I tell you what, that they continue to raise more money. Yeah. The CEO says that they have reached $150 million revenue run rate, up from $60 million at the end of 2024. You know what I always kind of wonder, well, not always, what I am wondering about more and more and more is margins in these new businesses, right? And whether or not the funding is going to, like, what's the funding going to, right? Like have they turned the corner, on EBITDA yet? Like, and if so, what do the margins look like? Yeah. Like lately I have not been hooked on the top line revenue numbers as much as I have like the EBITDA. And the reason is simply because we know $1 trillion's coming out of the system over the course of the next, 10 years, right? So And we haven't yet gotten to the real AI enabled clinics, right? So it is good if you can acquire patients in your brand and get that stickiness. That is actually a great moat, especially if there's a high degree of satisfaction. I think there's a lot of affinity for these brands who are focused on these women health specific issues. Menopause obviously is a huge one, right? Yeah. Like, what was totally passe, and now finally, like we're admitting this is a life stage every woman goes through, and it's very
half
important.
The population.
Yeah, no, it's just crazy. So it ought to be a big business. I just am so interested in understanding what does the P&L actually look like on these businesses.
Yeah, I mean, I don't know, but I think what I'm watching that's I think pretty interesting is healthcare has never been really strong at marketing a brand.
Yeah, great point.
Midi is building a pretty good brand in women's health nationwide.
It's a great brand, yeah.
And I'm also watching like Hims and Hers, but Hims is probably more like a man's brand. They do have Hers too. And they're kind of taking primary care away from traditional health systems and making it more like nationwide, mostly virtual. And I don't know if it matters if they're profitable today. As AI comes in, I think they're going to be able to do a lot more and cut costs out. It's sort of a market share grab, brand building to make money 2 years from now.
Yeah, that's a really fair point. BeSound raises $6.8 million to expand breast cancer screening for dense tissue in younger women.
There's something in the technology that if your breast is a certain density, it's very difficult to diagnose, and they have a new technology. But I don't. That's the extent of my understanding of it. But it seems promising.
Hey, I'm all for more screening.
Yeah,
but like
more screening and more accurate screening.
Yes, more and more diagnostic, more and more screening. We're not doing nearly enough of that in the cancer world. So that's great. ICHRA administrator SureCo secures $23 million in funding.
Yeah. So
this is importantly, it's led by Health Velocity and Kaiser Permanente. Right. So that's really strategic money right there.
Yeah. Health Velocity is good guys, Bruce here and Marty in San Francisco, and they have a lot of payer LPs.
Yes.
And so what's interesting about this is ICHRA is on the ascent, and it is clear to me at least that Health Velocity and Kaiser with, Kaiser runs a big payer.
Yeah.
They are supporting it and bringing it out.
Vic, I got to just give you the credit for this. Even before Health Further, I think about our 15 years we've been together, 11 years focused specifically on healthcare. One of your earliest sort of mantras is that we're moving from defined benefit to defined contribution.
Yeah,
and that's exactly what ICHRA really is, right?
Yeah,
this is just
right.
like we're getting out of the business of like managing health benefits, and we're just going to give you some money and let you take care of it yourself, right?
Yeah. I was 10 years too early on that.
Yeah, but you were right.
Yeah.
And it's not over yet, right?
Yeah.
And it's not over. Assort Health brings in $102 million in 4 months to build out voice AI platform. Man, I'm so glad we're not in this space. Holy cow. This is a $76 million Series B round. Let's see who's in here. Lightspeed, first round capital. So, again, more blue chip brands going after the obvious hyper competitive big check opportunities, right?
Yeah. And I think, I have assets in this space and Foundry has assets in this space. We are not in the capital raising like this. I think that my opinion is the frontier models will get better and better and cheaper, and sort of building on top of that where you can plug and play into any of them is what we've been executing. They're building their own sort of RAG model. It's not exactly a full LOM, but they're spending a lot of money in a place that I don't think it makes sense to spend, but that's what they're doing.
Well, good for them. Head into policy. The White House unveils TrumpRx drug buying site and a Pfizer pricing deal. I totally missed this. Is this real?
Yeah.
This is like Mark Cuban's Cost Plus Drugs or something? What is this?
No, it's a competitor to that, but it's direct to patients, but the government is running it.
What?
In competition with
No, that's what I just said.
In competition with.
That's what I just said.
Yeah, it's like that, but it's
that's what
owned by
I
the
just
government.
said. There's a government competitor
Yes.
to Mark Cuban Cost Plus Drugs?
Yes. Named TrumpRx. And
you can't
Pfizer,
if you're not watching, you can't see my face right now.
Right, I know. It is, I mean,
what?
It's, Trump keeps coming out with like the next thing. And so there's so many questions. There's no clarity on how prescriptions are written. For instance, consumers can't just go buy drugs. You need a prescription. Mark Cuban's thing has that managed. This is just like they announced it and they'll figure it out later. And Pfizer got a deal on so they're covered. It's a very scattershot approach, obviously.
I can't even discuss this. I literally didn't know. I didn't know that this happened until just this second.
Yeah. Well, I should have prepped you better, maybe.
Texas Stock Exchange could start listing shares next year. Okay, this is something I was more prepped for. Yeah, I mean, look, how many stock exchanges are we going to have distributed around the country in 3 years? How many you think? Think California
6.
California starts their own.
Yes.
Texas, New York, where else? Florida.
I think Chicago.
Florida.
Yeah,
We'll do their own.
Yeah, I don't know if Florida will be with Texas or not, but yes.
No, they'll do their own. They'll do their own. And then Illinois, Chicago.
Yeah.
Okay, so was that 5?
Yeah, I think it'll be even blue and red, so maybe it'll be 6. And then it's a weird dynamic because NYSC owns this, but it's domiciled in Texas.
Yeah, it's gonna have different rules.
Yeah, right.
Yeah, I mean,
right.
we're moving. We're going distributed, right?
Yes, that's right.
We're going distributed. We don't need a centralized one with the same set of rules.
Right.
You know, we're moving into more of a frontier world. We're moving into an AI world. We're actually going to have an explosion of companies. We know from this year, because of Cursor and Windsurf, that we're going to have more companies. We're going to end the show talking about the valuations of these AI companies. But there are going to be more companies that reach these ridiculous valuations in record time than we've ever had. And so therefore, like, it kind of makes sense to have diversity of exchanges for different rule sets, different benefits, et cetera, right?
Yeah, and investors are going to trade across all of them.
Well,
right?
but finally, it also tells more of the truth of the reality of different states being in the economic development competition, right? I think Texas is just making the implicit explicit here, right? Texas is in competition with all the other states to attract businesses to domicile there.
Yes.
Right. And not just because of courts.
Right.
But for a great many other reasons.
It's a whole set of things.
It's a whole set of things.
Right.
Yeah. And the exchange is just one of those things that you have access to and are enabled. It's a fork, right? It's like a fork of the core code base.
Yes. Yeah. It's not. I mean, there's a lot of effort, but maybe they raised $200 million. It says it in the article. It's a meaningful amount of money, but then you have the whole exchange.
It'll be fine and it'll be real. And Elon is the anchor.
Right.
So there you go.
Yes.
Right. I think actually that is going to be the most important thing. Who is your anchor ticker?
Yeah, because you need to get attention.
Yes.
It's attention more than capital.
Yes. Yes. You need a market maker, effectively, right, to drive liquidity and transactions. Okay. The U.S. to take equity stake in Lithium Americas and its Nevada mining project. Again, Wall Street Journal. Thacker Pass is among the largest known lithium deposits in the United States. That's exciting.
Yeah. So continuing the trend of the U.S. government taking ownership stake in assets. The first time that ever happened was with Intel a month ago. And now we have the second one, unless you count TrumpRx as one.
Okay, so we were talking before about the Democrats not having a good story for the deficit. This is the Republicans' answer.
Yes.
They're not attacking it from the spending perspective.
No, they can grow their way out of it.
They're growing their way out of it. And like they're doing real things that are legitimate balance sheet growth moves.
Yeah, that's right. I mean, whether it catches up or not is immaterial. They have a talk track that is coherent.
Yes, absolutely.
Yeah.
I mean, between the strategic Bitcoin reserve to Intel to now this Pfizer drug site to this lithium thing, it's like they're in business. Right. And look, by the way, that's just the honest truth. We've had concentration risk in the business of America. The business of America was overly concentrated in the dollar.
Business of America. Unpack that. What do you mean by that?
We've just been selling dollars to the world.
Yeah.
That's all. That's the only business we've had.
That's the only thing the government had.
Two things.
And military.
Yeah. Yes. And military services. And we're getting out of that game. Right? We're getting out of the selling our military services game. And so redeploying that into, like, for people who don't understand, like this, like America does have a business. Okay. It's not just collecting taxes.
Right.
You know, we do make money in ways. And this is a diversification of the way that America makes money.
Yeah.
Right.
Yeah, that's right.
So this kind of stuff, the slippery slope of it is that you're picking winners.
Yeah, that's a pretty big slippery slope.
Yeah, but dude,
this is like in resources.
But dude, we do it at the policy level all the fucking time. I think that's why I'm like, I don't know that I care as much, because we have a history of Bill Gurley pointed this out in his talk. So you can't even say this is what the Republicans are doing. What happened with Obama and Judy Faulkner and Epic? Dude,
Obama
was that not picking a winner?
Billions of dollars.
Was that not picking a winner?
It was.
So I guess I'm just making the point.
But we didn't get any. Yes, we picked a winner in policy. We didn't get any assets.
And we got no assets for it.
Right.
And we got no assets for it.
We're picking winners and aligning ourselves and getting paid for it.
Yes, I'm just calling a spade. Like, we pick winners in America.
Yeah.
Anyone who says that this is a pure meritocracy is totally head in the sand. It's not what it is. So at least we can improve the balance sheet if we're going to do that.
Yeah.
You know what I mean? At least improve the balance sheet. We hold on. We picked winners when we bailed the banks out.
Yes. We've always picked winners.
We pick winners. This is not like, quit the fairy tale stuff, man. All right. FDA approves new generic version of the abortion pill Mifepristone. Yeah. I'm proud of myself. I finally got it right. Mifepristone. Okay. The decision, which has drawn backlash from anti-abortion groups and lawmakers, comes as the agency launches a review of the drug's safety.
So this is interesting to me because the FDA is making a policy decision that's against the religious right, certainly, but following science. I mean, if the molecule can do the same thing that the branded one does, traditionally the FDA has approved it. And so that's just interesting to watch. I don't really know what that means, but I was a little surprised about that.
Okay. I have a question for you.
Okay.
We've already seen a couple of interesting things happen at the FDA. And going into this, you and I said, Marty's a real legitimate guy, right? Mm-hmm. Do you think that there is ultimately going to end up being, like, I don't view Marty McCary as a like right-wing kind of guy.
Right.
I view him as like,
I think he's
conservative, but
he's also going to try to have the science be borne out.
He's conservative, but he is for reform. Mm-hmm. But like, I think his first principles are pretty solid. And so I wonder over time, I don't view him doing a whole lot of things that are fundamentally political.
Right.
And I think it's going to be interesting to see if
that survives.
See if that survives.
Yeah. I'm hopeful that it will. I mean,
I think it's going to be interesting to see if it survives.
Yeah. Right. We'll all be better off if the FDA can try to focus on, is something effective and safe or not.
It's hard to see how the center holds, though, right?
Yeah. Yes.
Like it feels to me like he's playing the center.
Yeah.
Right.
I mean, that's why I thought this was a surprising ruling.
Yeah.
But good, but positive.
Yeah, we'll see how long it lasts. Mm-hmm. Okay, you picked a story here covering Nashville Healthcare Sessions. So that is, for those listeners who are not in Nashville, that is Nashville's annual, really great healthcare conference that the Nashville Healthcare Council throws. It's held at the Country Music Hall of Fame. I have to say, I think they are doing an exceptional job with what the charter of the event was, right? Mm-hmm. The charter of the event was Nashville is at least one of the healthcare capitals of the country.
Yes.
And the idea that we don't have an anchor event that this industry is like totally behind, and the Healthcare Council is the appropriate organization to do that. And man, I see people coming from all over the country.
Yeah.
Like important people are coming into town for this event every year. So I think they really are doing a great job. This is year 3.
That's right. Yeah.
I think they're doing a great job of establishing this brand and starting to like eat away at the, some of the other, I don't want to name any names, but I think they're starting to eat away at some of these other ones in a really important way. So
that's why I wanted to cover it. I mean, we were both there. You were a speaker. They had great speakers. There were national people there, but there were nationwide speakers. Yeah. And I think they did a good job. So what were your takeaways from the event?
So, I mean, look, just generally speaking, as far as conferences go, if I'm not speaking, I generally don't go.
Yeah.
The only exception to that is HFMA because I'm on the board.
Yeah.
So that's just that's no knock on the conference. Yeah. That's just where I am in my career and like what I do. So so I was there for the half day that I sort of spoke at. I don't really go to attend conference panels. For the time that I was there, I thought it was great. I was able to do a lot of networking in a flash very, very effectively. That was awesome. I met people who had traveled in from around the world for it, which was great. Not just the country, but around the world. Man, I was on a 2-person panel in the Barclays stage. It was more about like the markets with David Colucci, who's the one of the managing directors at Welsh Carson. And dude, I learned, first of all, dude's super smart.
Yeah.
And it's Welsh Carson. Like, this is an iconic brand. I felt amazing being able to be like the representative for venture capital next to Welsh Carson. And dude, he's brilliant. Like, I learned some really important things about what's happening in healthcare private equity from just listening to him, and being on the panel. So it was a complete good use of my time, right? A really, really good use of my time.
Yeah.
I thought it was great. And I'm proud of the Healthcare Council. I'm proud of the Nashville Healthcare Council for, sticking with it, executing, and continuing to build the brand. It's really good.
Yeah, I agree. It was a good event. My takeaways were that there were a lot of speakers I wanted to hear. David Feinberg and the head of Ascension talked about Ascension rolling out Oracle and the AI use cases.
That's awesome.
And they did a great job. And there was a lot of discussion, partially because it's what I self-selected to, but around the use of AI and technology and wearables. And everyone is trying to incorporate technology into their business. The two things that weren't really there that I think just are sort of the elephant in the room One is that there's a lot of talk about building AI to help with workflows and helping the line workers get tasks done more quickly. But then when I would dig in, like at lunch or around the sides about, well, what workflow have you mapped out and or actually like addressing, I couldn't find anyone that had actually gone and done that. So there's a lot of talk about like this is
I don't believe that
where
part.
we should go, but they haven't actually. I couldn't find anyone that had
on
done
the clinical side, when you say workflow, you mean clinical workflow.
Clinical side.
Yeah, I don't buy that part.
No one. I couldn't find anyone that had done it.
I don't buy that part.
So there's a lot of talk about
it's
maybe
the
where
back office.
The back office they're doing, but there was talk on stage about also going to the front office, but I don't think that's
they're
real.
not doing that.
Yet. That's real.
No, they're not doing that.
And then there was no talk at all about the reimbursement pressures, which seemed like a glaring gap. But I think it's because there's no good answer.
There's no
so
good
it's just
answer
too
to that.
depressing.
There's no good answer. And at this point, there's not even a dominant player in those pressures, right? Like the dominant player is the government.
Right.
So I mean,
so there's nothing to say.
There's
It's
nothing
just
to
like
say.
depressing, but
Right.
There was a lot of happy talk about how AI is going to make a big difference, but not a lot of detail, and then no talk about reimbursement.
Yeah, gotcha. Okay. Moving on to health systems. CommonSpirit announces initiative to address mounting headwinds, lagging finances. Here's a quote from the CFO, Dan Morissette. We've worked hard, but have not made as much progress as is needed. This is what they said in their 2025 annual financials. And I guess that is interesting because Ascension just came out last week and actually like totally has got back into the black, right? So that's we at least can see Ascension has made into the black. CommonSpirit maybe not yet, right? Once again, reporting an operating loss for this fiscal year.
Right. Yeah, and I think the difference to me is Ascension has a much better balance sheet investment effort.
Okay.
And so they're able to offset operations with gains on sort of their private equity venture assets that I don't think CommonSpirit has. Now, maybe that's not right.
Okay. That's interesting. This is me shooting in the dark. I literally don't have the data. If you ask me what's the guess, my guess would be Ascension is a very, very, very large nonprofit. However, you often find them in great markets.
Yeah.
And I think generally speaking, CommonSpirit, not so much. I think CommonSpirit is very, very large, but they are a little bit more on the mandate for the poor,
right?
And urban core. To me, CommonSpirit feels more safety net, than Ascension.
I think that's right,
and that to me feels like the larger.
And that's why they haven't done private equity investment. They in the last couple of months they added some ambulatory surgery centers, but they haven't had significant presence in that.
Yeah,
and then their markets are not as optimized.
Again, I don't have the market layup between Ascension.
Right.
This is just my anecdotal experience of where I have seen Ascension hospitals versus where I understand CommonSpirit to be. And if I had to guess, I think it's market and payer mix is the bigger differentiator and the challenge here. All right. Fierce Healthcare. Hospitals' administrative burden under 340B pilot far outstrips government's estimates, AHA says.
So the last part is important. Of course, the AHA says that, right? But what they're saying is that in order to implement this pilot of instead of the hospitals getting the money up front, they're going to get the money, the rebates like paid at the end. There's going to be a lot of overhead that the hospitals have to put in place to now collect that money. So not surprising AHA is lobbying around that.
Yeah. In the future, we may need to talk about whether or not we're going to like cover these kinds of stories because, and this is no disrespect, like AHA, we have lots of friends there. We have a relationship with them. So hospitals administrative burden under 340B, right? So in the past, we would have covered this because of the track record of effectiveness that the AHA had prior to the Trump administration.
Yes.
Right? The change here, let's be clear, is the Trump administration. That is the change. That is the fundamental change that has happened.
Yes, and they're not going to listen to what AHA is saying.
No.
Yeah.
No. And so I think it's
I think
these story, the importance of these stories is diminishing.
Yes. Yeah, we're going to change the not the whole show, but a piece of sort of how the show is structured over the next month or so. I've already written up some stuff for the.
We have to. Yeah. We have to. the world is changing. We have to kind of adjust a little bit, right? General Catalyst HATCo finalizes the Summa Health acquisition.
Yeah,
$515 million deal.
I mean, it's great to see. There's not a lot of detail in the story. It's closed. It's finished. They own it now.
VC firm, y'all. Yeah. This is not a private equity firm.
VC firm.
Venture capital firm owns a health system and a multi-billion-dollar health system
with a little payer piece too.
Yeah.
It's the payvider model that we all want to see. Built
and
out.
Again, with the former CEO of Intermountain,
right,
driving the car.
Yeah.
This is look, if anyone who just outright dismisses this, you're
not paying attention.
You're not paying attention.
Right.
You're not paying attention. Right.
I mean,
and that is not to say that there aren't going to be all these challenges and all these things. And like, that's not to say that at all. But you cannot say General Catalyst and the leadership that's there, Mark Harrison, and the scale of this health system and just the historic nature of the transaction. It's historic. VC, has a VC firm ever bought a health system?
No.
So this is like, it's something to watch. It's something to watch. I
think we're going to learn
excited about it
from watching what they do because they're going to do a bunch of stuff.
Yeah, and I know that a bunch of our listeners don't like when we say General Catalyst, like they might just think like they're another VC firm or whatever. They're not as out there from a brand perspective as like a A16Z is, or they even don't have like the legacy of a Sequoia or Kleiner Perkins or anything like that. They're interesting in that way, right?
Yeah.
But we're talking about a top 5 VC firm.
Yeah.
When we talk about top 5, you have their ability to raise capital is like otherworldly, So their ability to deploy capital towards this end is very interesting.
They can raise as much capital as they need for this. That's what you're saying.
That's what I'm saying.
But they're going to, unlike a private equity firm, there are private equity firms that have bought and sold hospitals before.
Sure.
General Catalyst is going to bring technology, new business models, new approaches because that's what they do. That's what the VCs do.
That's the difference between PE and VC.
Right. Yeah.
PE, financial engineers.
Right.
Swap out the operating
add
team,
some debt,
add some debt, thin out the team, blah, 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 increase the margin, sell it back out. This is Health Assurance Transformation. HATCo stands for Health Assurance Transformation.
Yes.
They are after transformation.
Right.
Because that's what VCs
I want to
do.
learn from it. Yeah.
That's what we do.
Right.
We don't financially engineer.
Right.
We transform things.
Yes.
Right. So this is it's amazing actually. GoodRx stock climbs on potential TrumpRx partnership, expanded Kroger tie-up.
I mean, they've pulled down. They climbed a lot. The stock went up a bunch. People are thinking, I think it's probably right, that they're going to be involved in sort of how this is translated to practice. And then they also expanded with Kroger, so they're growing.
I spent a lot of time earlier talking about how I thought the lithium equity thing was good, and we talked about the market making and the picking winners and things. I think there's a caveat that I need to kind of bring back up, right? Which is I really like seeing them do it in areas where we're struggling and we have a strategic imperative to get strong. And I actually feel that is a unifying...
In Intel and Lithium both.
And Bitcoin.
And Bitcoin, yeah.
Because our currency is struggling.
Yeah.
So I actually think across all of those, it's actually strategic. It's like... Intel's flailing around, and there's a lot of good bones there. We just got to get that thing back going. It will be good for America to get that thing going. It's not very competitive in the market today.
If you're going to buy from Intel, you have to believe they'll be in business 5 years from now because they take so long to get put. So having like a stable, big source like the U.S. government allows them to make sales.
That's right. Yeah. And the same I think is true in the lithium category. Yes. Getting into more rare earth here, we're nascent in that space, right? China 93% rare earth, and Africa probably makes up the other 6%. So again, that's an area where America is nascent and we need to get globally competitive, right? This one, we know Mark Cuban is not in the good graces of Trump. He's not an enemy per se. Mark Cuban is the center.
Yeah, that's right.
He's the center, right? And
he's very transparent. Like his thing is just transparency.
Yes.
He makes whatever he makes, 15% margin or something, but it's posted on the website what they make.
This one feels different, and I think I'll stop there. But this one feels different in that regard. You know?
Yeah, I mean that's the slippery slope part. Like picking winners is sometimes okay, depending on if they pick something that is either necessary or there's really no good way out otherwise. But picking winners in a market where there could be healthier competition may not be good.
Yeah, there's already healthy competition between GoodRx and Mark Cuban's cost plus drugs.
Right.
So that's it, right. Like that's different.
Right. Yes.
That's different. Okay. Cardinal Health to build Indianapolis pharma plant to supply growing distribution. That's interesting. So, Indianapolis is Lilly town.
Yeah.
So I wonder about...
I bet Cardinal and Lilly have a good relationship.
I bet they do.
Yeah.
I bet they do. That to me seems like some behind the scenes relationship development work there. So, okay.
Yeah.
Indianapolis has actually, I've just been watching them as a city, the moves that they've been making across a variety of different, worlds. And, in the sports world, I keep up with that. The Pacers had a great year, but also their economic development city stuff. Like they did a multi-event deal with WWE where they've got a future guarantee on a WrestleMania, but then they've also got like a bunch of these other little events. And those are really huge for like boosting the local economy.
A lot of travel into that.
Yeah, there's a lot of travel in that. And so Indianapolis feels like one of those cities we should keep an eye on, as a sleeper tier 2 city. That's a big deal, right? That's a big deal. All right. Genmab to buy cancer treatment developer Merus for $8 billion in cash. Transaction is expected to close in 2026. This is our first acquisition story in the pharma space.
Yeah, that's right. So it is a cancer treatment. It's in the late phase 3 trials right now. So I think it's, a lot of promise. $8 billion is a pretty big price.
That's a big number. Yeah. Okay. And again, I mean, if you're
pharma stuff is hard to know the science. I mean,
But if you're tracking over, the last year of stories that we've said, where are acquisitions happening? Oncology and weight loss.
Yes.
There's only 2 spaces where people are building up their pipeline war chest, right? Is there a third that I'm missing?
I think cardiac still is once in a while, but there's a lot of stuff already built out in cardiac.
Yeah, I mean, I'm just not seeing as many deals in that. I see mostly cancer and weight loss.
Yeah,
right. And weight loss is a much broader thing. It's kidney, it's liver, it's all these things, right? Oh wow, GSK CEO Emma Walmsley to step down. Walmsley's being succeeded by commercial chief Luke Meals after more than 8 years at the helm. That seems like a good run. That seems like a succession planning thing, not a nothing.
Yeah, I don't really know the backstory behind it. It just seemed like kind of a big story. I mean, obviously, European
I mean, it says drug makers working to replenish his product lineup. I'm sure that there's something there. Oh, looks like they do have an activist investor, Elliott Management, that's pushing them. So, I mean, Elliott's all over the place, man.
Right.
Ooh, if you do not want them on your, I mean, depends if you're a shareholder and you feel that they actually do a good job, but. If they're there,
the management is in trouble.
Management is in trouble. Yes. Okay. Is this Health and Us story? Okay. Recovery is a journey. Readers share their advice after blood clots. The Club of Pulmonary Embolism Survivors opened up to a Wall Street Journal editor after her medical scare.
So, an embolism presents as pain in your calf a lot of times. And this is people should read the full story, but it often is not diagnosed correctly. There's examples here where you probably have a muscle sprain, but it can be really dangerous if it moves from your leg up to your head or lungs or heart. You can die, and so it's hard to diagnose. And then once you have it diagnosed, it's very hard. It's hard to treat as well. It's a slow process. So they went through multiple stories, and I didn't really know much about it, but it was educational. So I wanted to sort of this section, we're sort of highlighting things for people to learn about their own health, basically.
Yeah, unfortunately, my significant other actually knew 2 people who, in pretty short succession, died from a pulmonary embolism.
Oh, really?
And it was like these were otherwise healthy guys in midlife, kind of thing. So, yeah, that's. I'm glad you brought it up. It's scary.
Yeah,
it's scary because it seems like there's not that much you can really, kind of do about it.
Yeah.
Okay, New York Times: autism, ADHD, anxiety. Can a diagnosis make you better? What's the story here?
Yeah. So we have over the last 10 years, they documented in the New York Times a pretty good job saying that we're starting to diagnose autism and ADHD more than we have before.
Yep.
And we're also diagnosing people later in life, where you could be 25, 30, 40 years old and get a diagnosis.
Yeah.
And the question that they are bringing up, and they don't really get to an answer, but they sort of argue both sides, is, well, it is positive to give people a diagnosis so they understand what they're going through, and they can maybe get some treatments that they can cope better with at work, or maybe they do something to, whether it's a medication or like putting headphones on or something like that. That can be helpful, but also there aren't really good long-term solutions. And so it can also feel like you have this diagnosis and it's sort of preventing you from experiencing your full life, and can be depressing over time or can be difficult over time. And so for, our audience, which is in a lot of times making diagnoses or in facilities where they're making diagnosis, I think we need to decide where do we draw the line? Where do we want to diagnose people? Is it only if we can cure them? Do we diagnose them always, or somewhere in the middle? I have no idea, but that's what they're bringing up.
I think one of the things that's interesting is that, first of all, it's a bit of a pendulum swing thing. And I think that over time we will get better at it. Yeah. So I don't like the rush to demonize the diagnoses, because you and I both grew up in a generation where no one was diagnosed.
Yeah, that's right.
And hell no was that the case, right? I mean, it just was not the case.
Yeah.
I have quite good friends who, are turning 50 this year and struggled for adolescence, their young adulthood, and even to a degree struggle today, and had to wait way too long to get a diagnosis that actually could help them. And so, I'm
not saying I know what the answer is.
No. I'm just trying to sort of
frame
say,
it.
That's part of the story here too,
yes,
right? Everyone's saying we're overdiagnosing the kids. Well, what about all the people who were, forget misdiagnosed, just not diagnosed because it was not something we did, and their whole lives could have been so much better had we done that. And dude, I know like 5 of them, personally. So that there's got to be, some balance to that, right?
Yeah, it is a pendulum thing, and I also don't know that we know where the ideal amount is.
Right. All right, moving into Web3. Joe Lubin, who is one of the co-founders of Ethereum and the head of an organization called Consensus, that is like kind of an Ethereum company, they confirmed that SWIFT, which is the global payment network.
When you need to move big amounts of money.
Yeah, when you need to move big amounts of money, but it's really kind of a heavy European and American-driven network, is using Linea, which is an Ethereum Layer 2 blockchain to build its new payment system. So how do we try to communicate this to the layperson? Over the last year, you've heard us talking about the Genius Act. You've heard us talking about the rise of stable coins, the digitization of these tokens that represent U.S. dollars and are going to allow all manner of entities, whether we're talking about a small freelancer in Honduras, to banks, quite frankly, to move effectively dollars, they're representations of dollars, stable coins, but to move dollars without moving them through these slow, expensive middlemen networks. And SWIFT is kind of the granddaddy of those slow middlemen networks. Also a ton of kind of control, nation state control. The SWIFT network was what was leveraged to cut off resources to Russia,
right?
At the onset of the war with Ukraine. So it's not just a network.
I think SWIFT was used to take some of there, or grab some of the Russian resources, assets.
Because the assets were offshore.
Right.
And so
right.
the network segregated them from their assets.
Right. Yeah.
Right.
So SWIFT has used a network of banks, government agencies, quasi-government agencies to keep track of money moving in computer systems. We'll call them ledgers to like keep track of, I sent you money and I want to note that so that if we keep track of it. SWIFT has developed that global system for tracking that with old-fashioned computer systems that really started after World War II as we started having global communication networks. And so it's pretty interesting now that granddaddy, the oldest, biggest, most powerful of those networks, is shifting to use an Ethereum layer 2 to do their tracking, to do their settlement, to keep track of, I sent you money on a ledger. It's going to be now the Ethereum layer 2 ledger that keeps track of it.
Yeah, which is not Ethereum itself.
No.
It's a network that runs on top of Ethereum. And this is interesting. I think there are two messages I get out of this. One, the old world is capitulating. To me, this is proof that we're not crazy covering Web3.
Yeah.
Why the hell is the old stodgy network getting on a blockchain?
Because settlement is in like 10 seconds and it's cheaper and faster and more reliable.
And they're going to lose if they don't.
Yes.
They're only doing it because they must.
That's right. They're going to lose if they don't.
They're only doing it because they must have these features.
Mm-hmm. Yeah.
Okay, so that's the first thing. The second thing is, I think everyone in the crypto world is probably side-eyeing this Linnea blockchain.
Who the hell's Linnea?
I've never heard of that.
Right.
And second of all, if SWIFT picked them, they are probably a nation-state blockchain.
Yes.
That is not safe. That is not cypherpunk. That is not, self-custody. Right. That is not censorship proof. I bet you of all the things that Linnea is not censorship proof.
That's right. The governments are not going to give up their ability to take assets from a country they don't like.
Or an individual.
And so that's right. But once everything's on various blockchains, they can communicate with each other. They're interoperable. So like you and I can keep our assets somewhere else and then move into Lina, whatever it is, only when I need to send money at that moment.
Only for transaction abilities.
Right,
yeah.
right.
Yeah. So the upside here is this sounds like an awesome bridge between TradFi and DeFi,
yes,
traditional finance
right.
and distributed finance,
right.
or decentralized finance, right? So that's
everyone has SWIFT.
Yes.
All the traditional FI has SWIFT.
Yes.
And so now that SWIFT's going to be on ETH, it doesn't matter what layer 2.
Doesn't matter.
I don't care if it's a good layer 2 or not. I'm not going to store my assets there.
Correct.
But if I need to move money to Switzerland, I can do it that way.
I will use it for a transaction.
Right, yes, right.
So in that way, this is a huge win for crypto.
Yes.
I don't think there's any loss in this for crypto.
That's right.
You have plenty of optionality if censorship is something you really care about. But yeah, this is a pretty big deal. It's a pretty big deal. And then Wall Street Journal, crypto stockpiling craze cools after red hot summer. So this is the Wall Street Journal trying to cover something that has been a normal feature of the way that crypto cycles work, but also sort of talking about it like a bubble, and it's not a bubble; it's just the cycles.
Well, I think there's a cycle in crypto always, and these Bitcoin treasury companies, which is what they're really covering here, not all of them understand that, in my opinion. So I think there's going to be some that have too much leverage, just like in every crypto cycle.
That's part of every cycle,
right?
Too.
Yeah, they're going to be flushed out, and that's just how we've seen. You and I have seen it every cycle.
We've been flushed out.
Yes, which is why I do not leverage my Bitcoin position anymore.
Yes,
but not everyone has learned that lesson, and so I think that's what the Wall Street Journal is pointing out. But I'm not sure the journal itself understands that lesson. So
correct. We're in AI now, right?
Yes.
All right. First story. Want to know your future breast cancer risk? Just ask AI. Health tech companies are designing models that identify patients at risk of developing cancer and who might need more screening or preventative care.
This is the promise and the fear all in one story in my mind. Like, yes, AI is going to be good at diagnosing breast cancer years earlier. There's an example, if you scroll down, of a mammography image. And so there's no sign of cancer, but there is. AI can see it before humans can see it. There's also going to be a whole bunch of use cases that make people scared, and it's really a false positive. And there's just a lot to digest in this story.
That's the friction of the real world.
Yes.
And every application of AI will bring that.
Yes.
So that's not a unique feature of this.
No, it's not unique to this, but
Yeah.
it is.
So here's what I want to ask you.
Okay.
I'm only saying that not to discard it, but to a little bit minimize it.
Yeah.
I want to right size that
okay.
concern, because we're going to have that
That's
in
everywhere,
self-driving
right.
cars.
Yes, everywhere.
Every single thing we're going to have that. In the diagnoses of terminal diseases, do you believe, based on what we know about AI today, that it will be a net positive?
Yes.
Okay. That's honestly, I think, the only position we need to take on this.
There's no question.
It's
no
the
question
only
it's a net
position we
positive.
need to take on it, right? There are other things where I think we can have a more nuanced position, because I think it's harder to suss out the net positive or negative on it. This one, to me, yes, there will be incidents here and there, but whatever discomfort a person goes through, in 99% of the circumstances, it is worth them to go through that discomfort to save another person's life. That's my math. And I also don't think it's going to be 1-to-1. I think it's going to do something like, it's going to save 10 people for every one person that it creates anxiety for, right? So I see this as like one of the reasons why we have reason to be positive about AI, right?
Yeah. So I agree with that. And I'll say, in addition, okay, outside of AI,
yeah,
I spent an hour and 20-minute podcast on this channel with John Riddick, Dr. Riddick, my cardiologist,
okay.
talking about the choice of doing a calcium score versus a CT angiogram.
Okay.
And I wanted a CT angiogram.
CT angiogram, that's Clearly?
What's that?
Is that Clearly?
Clearly is one of the brain. It's not the one I got, but yeah. And so that's where they take an image of your entire chest.
I've got that. I had that done.
He wanted to make it clear that, at some level I can get whatever I want to get. But sometimes they'll see a nodule in your lung, and then they go do a biopsy for that, and there is a 2% chance that there's complications from that. And so we spent an hour talking about, in the old tech that we understand very well, that there's pros and cons, and you need to decide, are you willing to look at all these things? Because sometimes you can get another false positive, and then you get sepsis, and there's a problem with that. So I think there are things to understand with every diagnostic test,
yes,
whether it's AI or not.
Right.
But yes, more testing and more accurate testing is a net positive.
Isn't that just part of progress, though? Because over time, won't we figure out those edge case like those edge cases are part of it being new?
It's part of it being new. It's also part of you talking to your doctor, or maybe it's your AI advisor or whatever, your nurse. I talked to my doctor and decided I want to go this path. I understand the risks and I want to go this path.
I guess what I'm just saying is I don't see how it's not true that every diagnostic / imaging modality that we have brought to the world didn't introduce, we don't understand this thing. And over time, we build up a body of work to where we understand it better. And those cases in the beginning become more like, I see that doesn't matter. Right now, we don't know what we're looking at. So it's like, maybe we should do a biopsy. Over time, all that gets like crunched. And it's like, we've seen that thing now this many times. Now we're this much smarter about this thing. And is it going to work 100% of the time? No, modern medicine can't promise that. But I just think this is a natural step in the progression of, you know what it's like? It's like people making fun of, Elon's rockets when they blow up. It's like, how the hell do you think you perfect rockets? These to me are people who've never built anything. You know what I mean? It's like I built software, dude. Bugs are inevitable. They're part of the process of launching something. You know what I mean? And I just think the idea, but something could go wrong. You will never have progress if you're not willing to have some failure. You're just not. So I'm just trying to distill it to that first principle and say it's okay to point that out, but just understand every single advancement you enjoy today had a period of time post-launch where it had that same thing. It's not special for AI.
This test is new, so that's why I was trying to go to a well-established test. I was trying to say to John, let's give every person a CT angiogram. And what he was saying is if you give it to 10,000 people, you're going to have 2 people die because we found something that wasn't even real.
I disagree with what he said.
Okay, well,
the reason why we're not giving it to everybody is because it's not standard of care and we're not paying for it. He is extrapolating. He's the doctor, but like he's not the expert on rolling out innovation to the world.
I think the calcium screen is we should give to everyone.
It's standard of care. We do give it to everybody. Like if you ask for it, you can get it. Insurance will pay for it. It's not that expensive. The CT angiogram, you can't. Right. You got to go to one of these concierge. This is what I'm saying. Are you following what I'm saying here? Like it's a byproduct of what it is to roll out a new innovation. And think about how long we held back. I mean, it's like the Betamax VHS story. It's like Betamax was the better product, but we mainstreamed VHS. It didn't matter in the long run. We went to CDs and we went to discs, and now everything is digital and streaming, so it doesn't really matter. But like the best product doesn't always win. There's other friction factors, especially in a highly regulated environment like healthcare, that lead to certain things not coming to like. It's just not an empirical truth that this technology has this property to it. No, calcium scores are the way they are because we've been using them all the time, and also they don't have a visual component to it. Okay. I mean,
I agree it's a net positive. I think there are pros and cons.
Can I ask you a different question?
Yeah.
Are there things that a CT angiogram could catch that a calcium score cannot?
Yes.
Okay. All right. Okay, what about that? What about the people that get the calcium score and then they die from something that a CT angiogram would have picked up that the calcium score does not? What about that? What about that?
That's why I got one.
Okay, so I'm just saying like, okay. Why are we're innovators? So I just don't understand like why you're being a boomer. Like, don't be a boomer.
Okay.
Don't be a boomer. So this with all due respect to Dr. Riddick, I just,
Yeah, I mean, I agree that we should go into AI in medicine. And so there's going to be things to be cautious of, and we should still go forward.
Yes. And what I don't like is I don't like the implicit implication that somehow AI has these more dangerous properties when by the numbers it actually doesn't.
Mm-hmm. Yeah, that's why I tried to go to an old economy.
That's what I don't like about this. About the nature of that conversation we just had there.
Screening tests in general, I think, are like this.
1,000%.
Yeah.
And we would be better off with more screening than less. There's all these people who are arguing for less screening. Mm-hmm. And it's like, that's because you don't have any captured data for all the people that died because they didn't get screened. That's a void in your argument. You're totally basing it off of the universe that was screened.
It depends on the false positives and false negatives. So if you have
absolutely, but
too many, then you shouldn't give screens to everyone.
But don't you have to arrive at some level of statistical significance before you can make that determination?
Yes.
And doesn't it take certain allowance for failure in iterations to expand the scaling of it?
That's why, in order to discuss it, I moved off the AI one because we don't know. We don't know what the false positive is.
I feel like we're going down a rabbit hole here, but like, here's what I'm saying. our generation can't really imagine a world where we can't fly.
Yeah.
Can you imagine the generation that actually introduced airplanes? Can you imagine what they had to go through, the fear they had to overcome, the loss of life, and those things? Would you rather live in a world with no airplanes or with airplanes?
With airplanes.
This is what I'm saying. So the generation that is around at the onset of the new technology must accept some casualties for the long-term upside benefit to the species. That's what I'm saying. And I'm not asserting that this particular thing is, but I'm like, generally speaking, can we get better freaking screening? Like, we are not screening people enough.
Yeah.
You know, and dude, let me just say this, like, my lived experience bias comes from being a Black person and being, you know, socioeconomically pretty divorced from the majority of people in my demographic in this country, and knowing for certain the amount of screening that I get versus what the average person in my demographic gets, it's just not even the same universe.
Right.
You know, so I'm not an advocate in the way of I'm not an activist. I'm a capitalist. I try to make impact through capitalism. But like, my voice here is to say we are under-screening people. And it's always privileged freaking people making this argument around too much screening.
Yeah.
It's never poor people. It's never Black people. It's never, you know?
Yeah. I mean, part of it is I could pay for it myself.
This is Angiogram.
It's not the Angiogram,
Right.
because it's not covered. You can't get it covered.
That's my whole point about it. I'm like, we're nowhere close to statistical significance on that because only rich people can have it.
Yeah.
And guess what? If a rich person gets it and then maybe you got to do a biopsy, you're rich enough to go through that too. You're rich enough to make that. You can make that choice. You can have an informed conversation. You're worried about it, but how worried are you about it? Tell me the evidence. Tell me, you know, it's like you're informed enough to kind of, and oh, by the way, you got ChatGPT now. You can like run that whole thing through ChatGPT and have it give you some statistics on how likely it is, and then you can make an informed decision yourself.
Yeah, well, I'm sure I'm not. I need to go watch the episode again, but it doesn't matter. Let's move on. I mean, I think the idea of going full steam into AI, I'm in favor of. So.
We just don't have a choice. This gets back to the Nashville Healthcare Sessions thing. Like, so I was saying on stage, there is no choice, y'all. You don't have the people. There's no, like, you don't have the people. You must, A, you don't have the people to deliver the care. B, you can't afford all the people that you're currently hiring. You must leverage technology.
And the people are getting burnt out. We have to give them tools.
This is if you're emotional about it, actually, that is irrelevant. The math is the math. You don't have a better answer for the math. It's like Democrats in the deficit. You don't have an answer for the math. You have nothing for the math. You just want to do emotion. You know, can't we see we're in a crisis and we need some math now?
Yeah.
We need a little less emotion, a little more math. Not saying we don't need empathy, but like, can we have somebody who will look at the problem and make a clear-headed, intellectually honest decision on what needs to be done that doesn't have a huge gaping hole in it every time I like poke on it? All right, I'm done. I'm off my soapbox, man. I'm just tired of this. It's just like we are collectively smarter than this. I'm not the smartest person here, but man, we are dumbing ourselves down because we're overwhelmed by the change. And I'm sorry, but if we're going to get through this, some of these really smart, sensitive, emotional people are going to have to embrace the moment we're in. Like, we're going to have to stop running scared from the moment we're in. We're in the fourth turning. We're in the crisis. We are in our dawn of a world war, maybe. Like, you know what I mean? Like, this is where we are. And people make it dumb statements acting like the reality ain't the reality.
I mean, I don't know how I got into this. I was just trying to say that there's pros and cons to AI screening breast cancer at that early stage.
Okay, can we talk about how you got into it?
Yeah.
You're sitting across the table from me. I told you before we hit record, I'm done holding my tongue. Okay.
Yeah.
I hit my close on the fund.
Yeah.
I'm done. I actually have no. I'm done. I'm not even going to be who I was last week when I was recording. You know what I mean? I'm done. We have to. It is, and also I'm protecting my own brain. It's like there's all these little subtle things in every little conversation that we all have that are encouraging us to ignore what we know is real. This is not the time for that. So I'm not trying to come at you, man. Yeah. I'm not trying to come at you. I'm just saying we are in a once in a lifetime, once in a generational moment. People have to be more intellectually honest. They have to be more decisive. They have to steelman the opponent's argument. They got to realize the Democratic Party is toast. Like there's some things you just got to start to come to terms with. If America is going to get out of the situation it's in, it must change its balance sheet. It must stop spending so much damn money on healthcare. It must leverage technology to deliver care to the hundreds of millions of people who live here. If we want to have less unnecessary deaths, we must screen more people. That will create more 1,000%. It will create more false positives. You know, I would trade that for my mother-in-law's death every day. She should have been screened earlier. Mm-hmm. As long as people are getting screened at stage 4, I don't want to hear it. I don't want to hear it. I actually think that's the gross thing. Mm-hmm. That's the gross thing. The tolerance and the acceptance. It's just like how tolerant we've become of gun deaths. You know what I mean? Like we won't say the thing. We won't say the thing. We'll start pointing at every other thing. It's empirical data. Look at every other country on earth and look at our country.
Right.
It's like, what's the difference?
We have too many guns.
What's the difference?
We have too many guns. We have a lot more guns.
Yeah, and in the hands of young people and unstable people.
Everybody.
And, you know, so, yeah, of course. They're going to get used on other people. What do you think?
Yes.
All right, I'm done. Walmart CEO issues wake-up call. AI is going to change literally every job. How about I shut up for the next 5 stories? I'll shut up.
No, you can't shut up for the next 5 stories. I mean, this story is another wake-up call. Like if Walmart is going full steam into AI, everyone is. I mean, they're the middle America big box store.
Dude, I mean...
That's all.
We're in the middle of a government shutdown. I have people very close to me who are in real trouble right now. Mm-hmm. And they're my friend. So you know, I talked to them about this. Mm-hmm. And they're still in real trouble right now. When I wrote my stupid book, okay, in the first chapter, I said the status quo response to entrepreneurship is it's risky. And I said that, you know, you just calculate risk differently than we calculate risk. You believe these institutions are here forever. You believe they got your back. That's not how full contact economics works.
Right.
That's not how full contact capitalism works. When you become an entrepreneur, you learn the true nature of capitalism. And you learn, like, the balance sheet and the P&L reign supreme. Nothing matters more than the balance sheet and the P&L. And if you're an employee, you're just one fraction of a line item on that P&L. You ain't even on the balance sheet.
Right.
You ain't even on the balance sheet. You're a fraction on that line item on that P&L. And you're trying to tell me that's not risky? And now we have Walmart. We traded out many stores
for
one store.
The downtown Main Street.
Yes. For one store out in the burbs.
Yeah.
And that one store now is responsible for employing everybody. And that one store says AI is going to change literally every job. You trying to tell me that's not PR speak for AI is going to kill a bunch of jobs?
That's exactly what it is. And so if you learned to build products that people wanted to buy and became an entrepreneur 10 years ago, following your book, you could figure out something in AI to build. And if you are working at Walmart, you're just waiting for them to tell you what to do next.
Uh-huh.
And everyone's on one side of that or the other. So then the next story, we have China, DeepSeek in China. They brought out a new model and then halved the costs. So the model is better performative. It's smarter, faster, but it's half the price of the old model. And
what does China know how to do? Because we paid them to do it. What do they know how to do?
They know how to manufacture stuff.
At what?
At low cost. And
it's their core economic competency now.
yes.
It's their core economic competency.
And then simultaneously, I didn't bring a story on it, but they are no longer going to use NVIDIA.
They don't need to.
Right. Because it's an American company.
Yes.
They don't want to be beholden to America.
They don't need NVIDIA. Russia doesn't need SWIFT.
Right.
What's going on, Vic?
It's the fourth turning.
What's going on? All right. Bot networks are helping drag consumer brands into the culture wars. Remember when we were talking about Cambridge Analytica?
Yeah. Yeah.
This is where we've always been heading,
yes,
right?
That's right.
Right?
Yeah.
So and this story's in the Wall Street Journal, and like the picture here is Cracker Barrel, right? So we all know
the Cracker Barrel was sort of logo,
at the center of the...
Yeah, right. So there are networks of bots that have social media accounts. I mean, Elon talked about this 5 years ago, but
yes,
but they are controlled by one group might control 2,000 social media accounts.
Yes,
and they attack a consumer brand like Cracker Barrel. And then, of course, other people see that and chime in because they're on that team or whatever, and they sort of foment this movement and brought Cracker Barrel down. And they can do it to whatever they decide to do it to. That's the scary thing. So it is going to happen more and more.
Yep. I have more to say about that. I got no commentary. Okay, let's go into OpenAI's really big week. Features, financing, all sorts of stuff. Let's start with the fact that they finally have rolled out the AI agent shopping use case. It's like real live now.
Yeah. Yeah. So you can buy stuff through ChatGPT. They gave an example of a T-shirt. Really anything on Etsy. They have a couple other networks like that. So it's not particular stores. It's more like marketplaces.
Right.
It's very simple. You're talking to ChatGPT, and then it settles it through Stripe, and you're done.
Yes. All right. Next, Sora was rolled out. We're going to link to the show, the Limitless podcast, which we certainly recommend our listeners subscribe to. It's an offshoot of Bankless, totally focused on AI. Josh and Ejaz are the two co-hosts, and they crush it. So this is a
very good.
Unpaid.
This is where I get a lot of my sources from.
Yeah, and you will be early. Right now on YouTube, the Limitless podcast has less than 20,000 subscribers. So like you will be early if you subscribe.
You should watch it. If you go here somewhere, they have, I don't know if we would find it, but they have a picture. So Sora, everyone probably knows, but Sora came out and it can put either you or one of your friends, right? That's it right there.
I got it. Keep
one of your friends into an AI-generated 10-second video. And so they showed several examples, but the best one I thought was they show Sam Altman trying to shoplift
at Target.
And it's very realistic. I mean, it looks like him, and there's a security guard not allowing him to leave.
Yes. And so this is terrifying.
Yes.
This is absolutely terrifying. The fact that now anybody can make a video that is
that would work in court.
That is indistinguishable from reality. That could present a moving picture of someone doing something criminal. We already believe too much of what we see on social media. we already jumped to conclusions in the court of public opinion too quickly based on what we read and see on social media. And this guy, who I just do not believe he is a good guy. Sorry, Sam Altman.
Yeah. But he didn't steal discs from Target.
No, of course not. I mean, everyone knows he didn't do that. He doesn't have to do that. He's in partnership with NVIDIA. He doesn't have to do that.
Yeah.
Sam's fine. No one believes that about Sam. But it's all about the people who people don't know.
If you can do that with Sam's face, you can do it to anyone.
So let me give you a perfect example, right? I remember when I saw the video, Sean Combs dragging Cassie through the hallway of that hotel and stepping on her. Stomping. Stepping is not correct. Stomping on her, okay? And it was caught by hotel security cameras.
Right.
Okay. It turned my stomach so immediately. I that was it. I was against him from the minute I saw that video. That was it. Okay. You can make that video now on Sora.
Yeah.
And you can put that out there. Dude, we have just taken another so and
then when something really happens, it's very defensible. Like Sean Combs would now say that's a deep fake. And there's no way to tell. There's no way to know.
He was 2 years too late.
Right. Yeah, that's right.
He was 2 years too late because that's exactly right. He could have said that's a deep fake. Somebody made it on Sora. That's not me.
Yeah. Yeah.
So yeah, it's both, right? It's both. It's like if you have that kind of personal brand power, you can offset somebody coming out and saying something about you.
And if you don't, you're subject to anyone accusing you of anything.
Correct.
Yeah.
It's terrifying.
And
I know this sounds crazy because I was just the person talking about imaging and positive controlled use cases for AI.
At once. We were going.
It's hammer or it's the fire or it's guns or whatever. It is.
We have
is a tool.
Both feet on the gas, just full steam ahead.
Yes. 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 This is the stuff I want everyone to like really take seriously. And by the way, this is actually what makes me so upset. We're going to allow this to proliferate in society, and we won't screen people.
Right.
It's like, are you kidding me? What is going to cause more damage in the next 30 days?
There's no
rolling out screening, rolling out free screening because we have the technology to do it right now, and we can save a bunch of lives, and a couple people would be burdened with some false positives, or rolling out this deep fake weapon in our already highly unstable society.
Right. Yeah. I mean, it's pouring gasoline into a raging fire.
We're focused on the wrong things.
Yes.
All right. OpenAI's new Sora video generator is requiring copyright holders to opt out.
Yeah. So 48 hours before they released Sora 2, 48 hours, OpenAI notified every content maker in Hollywood and a bunch of agents and notified them that they needed to opt out, or if they didn't hear back from them, they were just going to go full steam and all their content would be made available. That's not the way copyright law works, but they don't care. They just are going fast, and they'll apologize later if anything comes around, but nothing's probably going to come around.
Can we just talk about the damage that could be done here? People whose whole life is their copyright.
Yeah.
I'm not going to stick on this. I just we're focused on the wrong things.
Yeah.
We're focused on the wrong. We are allowing AI in real time to do societal damage, and we're going to over-regulate a screening technology that could potentially save millions of lives. You get my point. Like this is what makes me so upset. It's like we are completely messed up in the head. Completely messed up in the head. All right, final point. And not only can you totally destabilize society, you can reach all-time high valuations while doing it.
Yeah.
So OpenAI's valuation is now $500 billion. this article here is Wall Street Journal. They're signing more deals in Asia, but the chart here is really what we should focus on, which is the growth in their valuation since April 2023. I don't know what that is, but I guess it was certainly in the no more than $10 billion range in 2023. It is now north of $500 billion. This is the largest privately held company that we have knowledge of, and it's larger than almost all the publicly traded companies as well.
Yes, that's right. And they have grown very quickly, and they have great technology. And
hold on. And by the way, they have a market value roughly equivalent to ExxonMobil, which reported annual revenue of $350 billion last year and a profit of more than $30 billion. So that, meanwhile, OpenAI is expecting $13 billion of revenue this year and a net loss in the billions of dollars. So they are losing money, but we already know tech companies can lose money. We believe in this. They can lose money and then they can turn it on and they can take out whole industries, and there's no problem with that. But we're just looking at the valuation differences.
But the revenue, normally you'd see revenue. I mean, they're expecting $13 billion in revenue. Mid-year, they had $6 billion. And so they were on $6 million or run rate. And so they need to double again in the next 6 months, which maybe they will. Sora 2 was popular. But they're right now at around 100 times revenue.
If you go by the $6 billion number, if you go by the 13, they're 35.
Yeah, right.
35 times revenue.
Right. And so I don't know. I mean,
They got the momentum, though.
They got the momentum. Yeah.
They got the momentum.
Yeah.
They got the momentum.
Yeah.
See, it actually doesn't sound like a crazy valuation to me.
Yeah.
If you're going to value an enterprise SaaS company between 7 to 10 million, 10 times, then OpenAI at 35 doesn't seem that crazy.
Mm-hmm.
Doesn't seem that crazy.
Yeah. So that was the week for OpenAI.
And that was the week for us all.
Sora 2, destroy copyright.
Yes.
And then allow your employees to sell $6 billion in shares in secondary markets at a valuation of $500 billion.
Yes.
So, pace is accelerating.
Thank you so much for capturing all these stories.
Yeah.
I didn't mean to give you a hard time.
No. I mean, it's part of the benefit of the show, back and forth. It's fun.
And we went long, but listen, we're in that moment, right? I mean, this is the time. This is it.
Yeah.
This is it, man. I mean, I feel like everything our entire partnership was leading to this moment.
Yes.
I didn't know it. We kind of did know it. We just didn't know it would feel so crazy when we got here.
That's right.
We've been talking about this for a long time.
Yeah. I mean, I feel lucky that we are. I mean, there's a lot going on, but I think we're reasonably well prepared.
Yeah. Yeah. We're still married.
That's right.
To each other.
That's right.
So, all right, man. Thank you. I will see you next week, albeit remote, but we will record next week.
Yeah.
Thanks, buddy.